Hello everybody, thank you so much for coming back watching my YouTube videos. It really means a lot to me and keeps me motivated, keeps me going. Thank you so much. Today video we are going to talk about pregnancy. What happens if you're pregnant, you're working in the NHS, what are the benefits, and how often you're gonna see the doctor, and what kind of scans you're gonna be having, when, how often you're gonna have the blood test, each and everything we're gonna talk about today. If you are interested in this topic, please watch the video till the end, and then like the video, share it with your friends, subscribe the channel if you like the video, if you like my videos, and if you find them helpful. Thank you. So let's say you're working in the NHS. When are you eligible for maternity pay? You should be working in the trust for at least 26 weeks to be eligible for the maternity pay or maternity allowance. Okay, 26 weeks. If you are new to the trust and it's not yet 26 weeks, you're pregnant, you are not eligible to get the maternity pay. All right, you may get maternity leave, but you are not allowed for the maternity pay, so it will be all unpaid. So plan ahead. If you are feeling like if you have planned to get pregnant, then you should be in the trust for at least 26 weeks to get paid. So this is about the work, and also they do at work, they do a risk assessment. Like if you are pregnant, they don't give you very heavy team, they give you a light team. They contact the occupational health, they ask them if there are any high risks for you. Like they do the risk assessment. You won't be working in the COVID patients, you won't be working with the patient who have like a viral diseases, measles, mumps, or whatever. So you won't be working with them, but your manager should ask the occupational health to your manager should ask you to fill the form, risk assessment form, and send to the occupational health, so they know that this person cannot work with these conditions, this person cannot work with COVID patients. All right, so this is work wise. They can make your work adjustments for you. If you are not happy to do long days or 12-hour shift, you can ask them to give you short hours, like early shift or late shift only, or if you prefer night shift. A lot of pregnant ladies, they do night shift because they prefer doing it. It's less work at night, and then they find it comfortable doing it. There is no rush doing work at night also. So a lot of pregnant ladies, they prefer to do night shifts when they are pregnant. So this is all about work. And also your colleagues, they give you some favor also if need to. If there is someone for turns or something, they can help you with the turns, they help you with the washes and everything. They're quite helpful if you are in a good team. And then also this is all about work. How you're gonna be eligible for the maternity pay. You need to ask your midwife when you are already 20 weeks for a form, mat B1 form, maternity B1 form. She gives you a form and saying that what is your expected date of delivery, and then she writes it down on that form, mat B1 form. You need to submit that form to the HR to be paid for your leave. Okay, so this one was all about work related things, right? So now we're gonna talk about your well-being and your health. So let's say you're pregnant, and then you need to see a doctor or a midwife. You're not gonna see your GP. Maybe you can tell them that I think I'm pregnant, and then he would say that you need to contact the midwife, or because the GPs, they don't see you when you're pregnant. You need to be seen by a midwife, and the midwife is also same as GP. I mean, it will be from your area. They have allocated areas, and you cannot see any other midwife. Let's say PO6, this is the postcode of this place, right? Then you will be seeing the midwife who comes here to see the patients in this particular postcode. So you need to contact the midwife. You can ask your GP surgery to give you the details, to give you their contact numbers, and they'll give you the contact number. You need to call them and ask them that I am pregnant, I need an appointment, and then they'll book you an appointment. And then the earliest appointment you're gonna get is at 3 months, when you are already 3 months pregnant. This is the time only they're gonna see you. Yeah, when you are already 12 weeks pregnant, that is the time. 12 weeks, 3 months pregnant, that is the time only the midwife is gonna see you. But they're gonna tell you anyways, so you need to call the midwife, tell them that I am pregnant. And also there is a form on the online NHS website. You can self-refer. If you don't want to be told by the GP, you can do it online. Search on the government website, NHS website, that I think I'm pregnant, and they'll show you. It comes up with the self-referral form. So you fill up your details, your full name, your address, your LMP, last menstrual date, and then you send it to the midwife, and midwife by herself gonna contact you. But by 10 or 11 weeks of your pregnancy, if you haven't heard anything from them, you need to call them and tell them that I've self-referred myself to the midwife, and then I haven't heard anything from them. Then they're gonna book you an appointment, and you're gonna go and see your midwife. So this is the time she'll ask you how you going, how you doing, and you are going to tell them I feel like I'm pregnant. It's already, so you will be the one deciding that you are pregnant or not, right? You cannot do any blood tests. You can do blood tests as private, like you can go to private doctor or a private lab to do the blood test to confirm whether you're pregnant or not. Or most reliable method here they use is the urine testing kit, sorry, for the pregnancy. So you can use the kit. If you're not sure, if you're not trusting one kit, buy another one and do one more. And Clear Blue is quite good, and then they trust on it. So you're gonna tell your midwife, I've done the urine test and it's positive, because she's gonna ask you before giving you an appointment, have you done a test? And then you're gonna tell them, yes, I've done the pregnancy test with the urine and it's positive. If you want to be 100% sure, you can do the private test before the midwife, and then just go from there. So at 12 weeks you will be seeing your midwife. She will do the set of blood tests for you. She's gonna do all the blood tests, like hepatitis B, C, A, what do you call it, STDI, also the sexually transmitted diseases, and then your CBC, iron, all those tests. And also she's gonna refer you for an ultrasound. You're gonna have an ultrasound at 12 weeks, so to confirm if everything is normal. And this will be your first appointment. Throughout the pregnancy you have 2 scans, one at 12 weeks and the second one at 20 weeks, if everything is normal. Okay, let's say if you have any condition, eclampsia, preeclampsia, or gestational diabetes, or cholestasis, or anything like that, then, or the size of the baby is big or something like that, then of course they're gonna do some extra scans. So every pregnancy is different, so they will decide how many scans you need. But in a normal pregnancy you will be having only 2 scans, one at 3 months and one at 5 months. That's it. But you will be having regular checkups with the midwives, and after every scan she's gonna book you an appointment. In between also you will be having couple of appointments with the midwife, and she's gonna do your urine test, urine dip each time you go to the midwife. And also she's gonna check the movement of the baby, heart rate of the baby, your well-being, and doing some blood test as well. You have also blood tests at 28 weeks. And if you need a extra scan, then she's gonna see you after that scan as well. Let's say if I need blood tests every 2 months or 3 months, the midwife will be the one who's doing the blood test. But in between your appointments, like you don't have any appointment for the midwife now, but you feel like the movement of the baby is reduced, or you feel like you need something urgent, then of course you can call the hospital, the maternity triage unit, and then book an appointment. They're gonna ask you what's the problem. If you feel like the baby's movement is reduced, or you feel like you're having some UTI or something like that, then you can make an appointment with the hospital maternity triage as well. So for the midwife, it's into your area. Sometimes it's only walking distance, you can walk to the midwife, go to the midwife, and then discuss each and everything. But sometimes if you have the scans, she doesn't do it, midwife doesn't do it, so you need to go to the hospital itself where they book you. So my closest hospital is where I work, and then they do the scans and everything there for all the pregnant ladies. If I have to, then they will be doing it there, right? So it depends on the situation where you live. If you have any close by hospital, you will be referred there, because midwife, they don't do scans, it's only the hospitals. And then for the scans, it's also always outpatients, maternity outpatients, not inpatient. So as outpatient, you go there as a patient, they do the blood test if needed, or the scans, right? And then after I think 8 weeks of pregnancy, you need gestational diabetes testing also. If they feel like you are at risk, or you are overweight, or you have family history of gestational diabetes, then they're gonna do a gestational diabetes for you at 28 weeks, and then they'll let you know if you are you have gestational diabetes or not. If not, very good. Then also your midwife is gonna keep a record of your blood pressure each and every time you go there. They don't do, in my country, right, they do blood test, not blood test, I mean weight checking each time you go there, but here they don't. So if you're worried about your weight, ask your midwife to do it for you, right? And then that's it. That's it, I think. At 28 weeks, you have gestational diabetes blood test. That's the test to diagnose if you have diabetes or not in pregnancy. Of course, you know, it gets better if it goes away when you give birth. After 28 weeks, next appointment you will be having for the scan is usually at 36 weeks for a scan, for third scan if needed, or else you're gonna wait till 40 weeks or 42 weeks if everything is normal. So at that, if needed, if you have any condition where you need an extra scan, it will be as at 32 and 36 weeks, 2 extra scans, and then that's the time they're gonna decide your birth plan, whether you're going to have a normal delivery or C-section, or whether it's induced labor or natural labor. Okay, so if you have any condition, then this is the case. If everything is fine, then you're gonna wait and see. You're gonna wait till 40 weeks, and if you get into labor naturally, well and good, or else you need to inform them, right, what's going on. So this is the process of a pregnant lady, how she's going to be seen by the midwife and the GPs. In between, if you have any other condition where you feel like you need to be seen by GP, you can ring them, ask for an appointment. Or if you need any medication, you can ask the GP, because the midwife, she doesn't prescribe anything. So it will be only from the GP who can prescribe you medications, who can give you anything. And if you feel like you need to discuss anything with your midwife, then of course you can do it. And then if she will also tell you that if that concern she can handle, or you need to tell it to the GP, right? So this is all about the pregnant ladies. You're gonna be seen by the midwife, not the GP, throughout, and at the end you go to the hospital. So here, as I said in my previous video, for the pregnant ladies, for the maternity also, you get an exemption certificate, where you're gonna get free medication. You won't be paying any medication for one item, you should be paying 9.35 pound per item for this year. Every year it's a different price. So for this year, 9.35 pound per year per item, 9 pound 35 pence per item for the for your prescription. Okay, but if you're pregnant, you can apply for the exemption certificate. Exemption certificate means where you're gonna get free medications for 1 year. For 1 year they will be giving you exemption certificate if you're pregnant. So you need to ask your GP or your receptionist that I want to apply. In your GP surgery, you need to go there, ask them, I want to apply for the exemption certificate, how can I do it? She'll give you the form, you fill that form and then give it back to them, and then they will send it for you. And then your exemption certificate comes to your home address via letter, via post. So now you got the exemption certificate, you are entitled to get free prescriptions, you're entitled to get free dental appointments if you have any problem, because sometimes when the pregnant ladies, they may have problem with their teeth or with the gums when they're pregnant due to certain hormones, right? So they get free dental treatment, they get free prescription, everything, almost everything you're gonna get free. You get the exemption if you get the exemption certificate. Maternity is included in the exemption list. When I go to the pharmacy next time, I'll get a list for the exemption list, exemption medication list for the diseases which are included, which what did I say? Sorry. I'll get a list of the diseases which are there to make you entitled for the exemption certificate. I remember there was diabetes, maternity, thyroidism, hyper, epileptic, but I'll remember when I go there to the pharmacy. I'll get a list for you and then I'll post it on my YouTube channel. Okay, so make sure that you are aware about that. You won't be paying for all your medication if you're not sure. Just ask your doctor or your receptionist at your GP surgery, am I entitled for the exemption certificate? Am I included in the exemption certificate list or something like that, right? You can ask them. There is no harm in asking. If you're not. All right, so that's it for today. For pregnancy, what kind of appointments, when, how often, with who, we discussed each and everything, right? If you have any queries, let me know in the comment section. So as I said in the beginning, for the leave, maternity leave allowance, you only get if you are 26 weeks in the trust. It's same same for you and your partner if he works in the NHS or if he works in the hospital setting, right? So 26 weeks without any break you should be working in the trust to be eligible for the pay. And in the upcoming weeks I'll make a video how much you're gonna get if you are on a maternity leave, and for how long you're entitled to have 1 year maternity leave, but you are only paid for few months. Okay, I'll make sure that I make a video very soon on this particular topic as well. I hope this video was helpful for you. If you find it helpful, please like it, share it with your friends and colleagues, and subscribe to my channel if you haven't done so. Press the bell icon to remind you about my upcoming videos. Please help me grow in this channel, because it takes too much time to prepare videos. It take efforts to think about the topic, and with work it can be quite difficult as well. So with your support we can go together a long way. Thank you so much for watching. God bless you all. Thank you.